Welcome, and thank you for joining us today. We are thrilled to present this session tailored specifically for doulas. Doulas play a crucial role in empowering and supporting birthing individuals throughout pregnancy, labor, and postpartum. By sharing information about Count the Kicks, we aim to equip you with a simple yet powerful tool to help expectant parents track their baby's movements or fetal movement, a proven way to improve birth outcomes. Together, we can strengthen early detection and intervention, foster trust in the birthing process, and continue to champion for healthy pregnancies and deliveries. In addition, some of the research we reference today will use gender-specific language like women or moms due to the original parameters in the reference studies. But we would like to acknowledge and encourage individuals of any gender identity who are experiencing pregnancy to use tools from the Count the Kicks program. So you will hear us using gender-neutral language throughout the presentation as well, including the term expectant parents. Before we start, I wanted to recognize that we acknowledge the sensitivity of this topic and the potential emotional impact it may have on some individuals. I encourage you to prioritize your emotional well-being, and it is entirely okay to step away from the conversation and the webinar today. As we dive in, I wanted to go through our agenda. Today, you will learn more about Count the Kicks, our evidence-based stillbirth prevention program. We will talk about how you can share Count the Kicks and how to monitor babies' movements with your clients. We will explore the Count the Kicks app and additional resources that you can utilize. And we'll talk about the power of doulas, as well as advocacy and empowerment. My name is Megan Ockett, and I am the program director at Healthy Birthday, which is the nonprofit organization that created Count the Kicks.
Hello, everyone. My name is Naya Thomas, and I am the Health Equity and Community Engagement Manager. And I also have a background as a birth doula as well.
So, Count the Kicks is a highly effective evidence-based stillbirth prevention program. Before we move forward, let's define stillbirth. Stillbirth is a loss of a baby after 20 weeks of gestation before birth. And at Count the Kicks, we developed a proven early warning system for expectant parents. We've saved lives in 36 states and 5 countries so far. Count the Kicks has proven to be a powerful tool in stillbirth prevention, saving lives across the United States and internationally. However, not all families have equal access to life-saving information or the same experiences within the healthcare system, which is where your role as doulas becomes critical. By understanding the disparities in stillbirth rates and how they impact different communities, you can help bridge the gap and ensure more parents have the knowledge and support they need to advocate for their babies. This slide shows national stillbirth data from the 2022 CDC report, and the rates vary significantly across racial and ethnic groups. And you can see here, 1 in every 177 pregnancies overall will end in stillbirth, and the racial disparities that exist and persist are unacceptable. 1 in 97 pregnancies for Native Hawaiian or Pacific Islanders will end in stillbirth. 1 in every 100 Black pregnancies will end in stillbirth. 1 in 139 for Indigenous pregnancies will end in stillbirth. And you can see the other additional race disparities there. And these numbers reflect deep-rooted systemic barriers and historical inequities, such as bias in medical care, lack of access to resources, and structural health disparities. The state-specific data within your own Department of Health can highlight these patterns even more clearly. However, it's important to remember that while these disparities exist, communities also have strengths, traditions, and practices around pregnancy and birth that have been passed down for generations, such as granny midwives, doulas, and kit counting. These cultural frameworks are powerful tools that help families overcome systemic barriers like medical racism, bias, and limited access to care. By recognizing these disparities and strengths, we can better tailor our stillbirth prevention and birth preparation efforts to meet the specific needs of the communities we serve. This is important because these issues impact communities in different ways, and understanding this will help us provide more effective support. So, when should you start talking about tracking babies' movements or fetal movement monitoring with your clients? The Academy, College Obstetrics and Gynecology, ACOG recommends beginning counting at 28 weeks gestation or 26 weeks if considered high risk or pregnant with multiples. So, right when your client begins their third trimester, this is when you really want to start having this conversation, or a few weeks prior. But at that third trimester is when they're going to utilize our resources, and you're going to talk to them about the importance of this. And why do we do this? Is because research indicates that baby has established a consistent pattern that the mom can feel and track in the third trimester. We're called Count the Kicks, but I want to highlight the fact that a Count the Kick is more than just a kick. It's a roll, it's a jab, it's a swish, it's a push, it's anything except hiccups. So make sure that when you're having this conversation with your clients, that you're highlighting the fact that it's any sort of movement except hiccups when they're counting their baby's movements. And here is how you have this conversation. This is a great digital tool that we have available on our website, but this really walks you through and will walk your client through how to monitor their baby's movements. So all you're going to say is you're going to say, great, you're in your third trimester. I want you to start tracking your baby's movements. Here's how you do it. You can download this free app that we'll talk about here in a little bit and track your baby's movements every single day, preferably around the same time each day. If they don't want to use the app, we also have awesome paper kit counting charts available on our website in multiple languages. However, they're counting, the most important thing is that they're counting every single day around the same time each day. So, what they're going to do is they're going to sit down, focus on baby. If they're using pen and paper, they're going to get out a timer. And if they're using the app times automatically for them. They're going to feel that first movement they want to start with. And then on the app, they're going to tap a footprint, which we'll show you in a minute, where they're going to mark how long it takes them to get to 10 movements. And they're also going to note the strength of those movements. What's really great is after a few days, the expectant parent will start to see a trend, the average amount of time it takes their baby to get to 10 movements. What you want to do is encourage them to count every single day, and that you want to encourage them to call the provider right away, go into their nearest birthing center if they notice a significant change in their baby's movements, and of course, to follow up and contact you as well. I wanted to highlight a quick resource. This is our Hallmark tool. This is our free kick counting app. And how it works, you tap that footprint that you just saw on the screen. That's going to run through a kick session while I'm talking. You just tap that footprint every time you feel baby move, roll, push, jab. I highly recommend downloading this app and using it so you can pull it out when you're talking to your clients and say, look how easy this is. Let's set up a pregnancy profile together and get you started. So right there, you can see I'm rating the strength of my baby's movements between fluttery to fierce. That little eye in the yellow circle gives you more information about how to track that. And this is available on Apple and Android products as well as the Apple smartwatch. We also have a web-based kick counter, so you can access this on a PC. If you have a client that always goes to the library every day and wants to count there instead, or at home on their PC, or at work, they can't take out their phone, but they can utilize their work computer, they can do that as well. Our app is free. There are no ads, and it's in over 20 languages. I'd highly recommend going to our website to see all the different languages the app is in. We're always updating and adding more. You can set daily reminders to within the app, and you can download history to share with the provider. They can share it with you, family, or friends. We recently added a contraction timer based on feedback from app surveys that we got, and from providers and other surveys from doulas and midwives. That was a request of ours. We really want to work within communities to ensure that we're meeting their needs, and contraction timer was one of those needs. So that was recently added. We also added OCR, which is optical character recognition. And what that does is you can use our paper kick counting charts available on our website for free. And a parent can count their baby's movements on a pen and paper like that using those charts and then scan it into the app. So eventually they can see the trend line and there's no need for any additional manual entry. There's also digital badges, which encourage people to do things like count daily, as well as additional free resources like FAQs, videos, and the like. We do not share or sell our app user information, so privacy is very important to us. I also wanted to highlight one of our newest tools, which is Ask Anna, our AI assistant. How Anna works is you can access it on our app or on our website, and people can ask fetal movement monitoring questions around maternal health, anything that they want to ask around how do I count? Do hiccups count? Which they don't, as we just learned. But what's really great about Anna is it's in multiple languages and it responds in an evidence-based way. So what we've done is we've worked with our medical advisory community and we've said, what are the research articles that are evidence-based? We want to ensure that they are included in this tool. So Anna responds based on curated research that we have provided to the app developer. She's not pulling in from TikTok or social media or anything like that. So I highly recommend using this too as an additional tool for you in your work in the community. I'd also like to mention our Find Local Resources tool. This is called Find Help. And you can access this on our app or on our website or via the link there below. And how it works is people just enter their zip code and then they can search for free or reduced cost services near them. Things like mental health support, dental care, food assistance, diaper banks, housing assistance. So this is another great tool for you to utilize in your community when you are working with clients that are looking for something specific. Maybe they're looking for childcare. This is a free tool also available on our app and website. Another great tool for you is our educational patient or client materials available in multiple languages. They're bright, colorful materials like you can see here. There's brochures, posters, app reminder cards. If you scan that code or go to www.countthekicks.org, you can click on order materials and then click on your state and fill your shopping cart. In a lot of our states, we have a funding partner, so these materials are free in some of our states in the United States, and some are low cost. So feel free to look at that website, see what works for you, and then order and use these as tools when you're having this conversation with your clients. All right, before I pass it over to Naya, I wanted to share one of our success stories with you.
She is his best thing. She is a happy baby. I am so thankful she got here safely. I hadn't felt her kick all day, but what I did feel was hiccups. And I'm like, okay, Destiny, she's alive because I can feel her hiccuping, but I don't know. In my head, I'm just like, something's just not right. It gave me a guide for something that I could do this time. And at this time, I feel like I had learned her. Like, if I drank that day, I tried to drink Pepsi. I tried to get some candy in me, and I mean, she wouldn't budge with the Pepsi, the candy, nothing. I still hadn't felt no kicks. Got in the car by myself, didn't even wake anybody up, because I'm like, oh, you know, everything was fine last night. I'm sure it's just me being paranoid tonight, and they're gonna send me back home tonight. The next thing I knew, I was in the operating room, and she was out within about 30 minutes. And she made the cutest little cry. I'm so glad I counted my baby kicks, because If I didn't, they were telling me that I probably would have lost her, just like my first child, if I didn't go in. That night I did. Count the kicks, just, I mean, it helped. It really did. It saved my baby's life. It really did. I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Listen to yourself. Listen to your body. Listen to your baby.
Destiny and Sonara's story are a huge part of the work that we do at Count the Kicks, and I know is a huge part of the work that you do as doulas in the communities that you serve, listening to the stories of the expectant parents and moms that you serve, and making sure that providers are also hearing and listening. And so for this next section, we really want to emphasize the role that you play in making sure that you are able to incorporate fetal movement monitoring into your practice. You do play a critical role, and part of that starts right at the prenatal meetings. So during the prenatal meetings, you can incorporate educating your clients about the importance of tracking the movements, starting in the third trimester, emphasizing how it can help identify potential concerns. You could introduce the Count the Kick method, provide an overview of how to use the Count the Kicks app or chart to track patterns of fetal movement. And you can share the resources, distribute the Count the Kick materials, such as informational brochures, Count the Kick charts, or details on how to download and use the app for your clients as well. Excuse me. And then part of your work as a doula is really empowering your clients to tune into their baby's patterns, and making sure that you are encouraging them to understand their baby's unique movements, and bringing up any patterns that they notice to their providers as well, and encouraging that open communication that can be incorporated into the birth prep. As a part of routine check-ins, as well as just ongoing appointments that do happen with their providers as well. So in addition to the ways that were just mentioned, you can continue to promote fetal movement monitoring by sharing the practice with your doula community. So you can collaborate with training with others, continue to attend Count the Kicks training sessions similar to this, or trainings that you learn about within your community or on our website. Feel free to join our newsletter. We do continue to update subscribers about upcoming training opportunities through our newsletter. You can share and disseminate materials like our brochures or our app information. Again, depending on what state you're in, a lot of those materials are free. And letting your doula community know that those materials are free is a good way to also promote awareness within the doula community as well. Another aspect of your role is making sure that you're addressing your clients' unique needs. So going back to what Megan mentioned previously about the different cultural needs of the clients that you serve. Every client has various cultural practices and community needs, and that runs the gamut of language access and cultural practices within different family dynamics as well. We do have a variety of languages that the materials and the app are available in. So for folks that don't speak English, we do have materials available in multiple languages, including Spanish, and depending on what state you're in, Arabic, Hmong, and multiple other languages as well. And the app is also available in 20 plus languages as well. In addition to that, just making sure that you're being culturally sensitive in the way that you approach um, pregnancy, and stillbirth prevention overall. Just tailoring your conversations about kick counting and fetal movement monitoring to respect cultural perspectives on their pregnancy care. So perhaps it's asking your client, are there any family traditions that you want to incorporate as we develop your birth plan around monitoring your baby's movements, or as we're connecting with your provider? Really make it personal and specific to your client is really beneficial in making sure that it's both relevant and applicable to their birthing journey. And then, of course, making sure that you're encouraging consistency, 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 consistency. So daily practice is essential. Um, Suggesting that kick counting become a part of just a daily routine for your client is very beneficial, such as after a meal or at a specific time of the day. Whenever the baby tends to be active can be really helpful. And then incorporating a partner, an aunt, a grandmother, a relative also can really help with that consistency aspect as well, and making it a part of the routine. Um, and integrating that aspect into the Count the Kicks app and and programming. So, as doulas, part of your role is to help address the concerns your clients have and provide them with accurate and supportive information. So, when it comes to stillbirth and counting kicks or the movement of baby, some common misconceptions might come up. So, I want to take a look closer at two of the most frequent ones you might encounter, and discuss ways that you can provide clarity and support for your clients. So one misconception that might come up is my baby should get 10 kicks in 2 hours. So that is false. Every baby is going to be different, and the recommendation to expect 10 is to expect 10 kicks in 2 hours is actually outdated. Current research indicates parents should work to understand the normal amount of time each day it takes their baby to get to 10 movements each day. So again, every baby is going to be different, and so that pattern is going to look different for each baby. So getting to know your baby or their clients, the clients and their baby's movements is going to be key and essential in order to understand what their pattern is. So that misconception is false. The next misconception I wanted to address is, if baby isn't moving, I should drink something cold or eat something sugary to get baby moving. So the research actually shows that we have moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice or candy. If baby isn't moving like normal, parents should actually speak to their provider right away to get support and identify what's needed for the next best steps, rather than leading into drinking something cold or sugary. So those are just two of the common misconceptions. There's additional information about misconceptions and some things that might come up as you're talking about stillbirth prevention with your clients in a digital doula toolkit that we are providing for all of the listeners of this recording. We have put together a digital doula toolkit called A Doula's Guide to Count the Kicks. And if you are watching this presentation, you'll have access to that toolkit. It provides you with ways to have conversations with your clients about incorporating kick counting into a birth plan, making sure that you're having these conversations in a culturally responsive ways, and also looking at ways to bridge the gap between um, communication with your client and their provider as well. So look out for ways to check out that digital doula toolkit as an additional resource for your practice. And now I will pass it back to Megan.
Thanks, Naya, so much. And so, as we close, we just wanted to highlight a couple things that you could do right now. Download the app, go into your app store and just search for Count the Kicks. It's the bright yellow clock icon, and then make sure that you register and set up a pregnancy profile. Even if you're not pregnant, go ahead and set that up so you can use it, set your reminders, and go through this with your clients. This is a free tool that is easily accessible in multiple languages. If you need more information, absolutely go visit our website. We have a lot of great education on there, additional research to review, additional digital tools. And then, of course, remember, ensure that your clients understand to trust their instincts. They know their baby best. And anytime that you can encourage that and work with them on that, I think that is key, trusting the instincts and they know their baby and their body best. Thank you so much for taking time with us today. We hope that you found value in this. We are so grateful and thankful for everything that you do as a doula in your community, and there's no doubt that together we will be saving lives. Thank you.